ACE inhibitors are medications used to treat high blood pressure, also known as hypertension and heart failure. They are also used to slow the progression of kidney disease in people with diabetes. ACE stands for angiotensin-converting enzyme. ACE inhibitors work by blocking the action of this enzyme. Common ACE inhibitors include captopril, enalapril, lisinopril, and ramipril. These medications are generally safe and effective when used as directed. However, like all medications, ACE inhibitors can cause side effects. It is important for nurses to be aware of the potential side effects of ACE inhibitors and to monitor patients closely for their development. Nurses play a crucial role in patient education, medication administration, and monitoring for adverse reactions. This video will provide a comprehensive overview of ACE inhibitors, including their mechanism of action, side effects, and nursing considerations to equip future nurses with the knowledge they need to provide safe and effective care to their patients. ACE inhibitors work by interrupting the renin-angiotensin-aldosterone system, a hormone system that regulates blood pressure. Renin, an enzyme produced by the kidneys, converts angiotensinogen to angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by ACE. Angiotensin 2 is a potent vasoconstrictor, meaning it causes blood vessels to narrow. By blocking ACE, these inhibitors reduce the production of angiotensin 2. This leads to vasodilation, the widening of blood vessels, which in turn lowers blood pressure. ACE inhibitors also decrease the release of aldosterone, a hormone that promotes sodium and water retention. This further contributes to their blood pressure lowering effects. In addition to their use in hypertension, ACE inhibitors are also effective in treating heart failure, a condition in which the heart cannot pump blood effectively. By reducing the workload of the heart, ACE inhibitors can improve symptoms and slow the progression of heart failure. While generally well tolerated, ACE inhibitors can cause side effects, some more common than others. One of the most frequent side effects is a dry cough, thought to be caused by the buildup of bradykinin in the lungs. This cough is typically dry and persistent, often leading patients to discontinue treatment. Another common side effect is dizziness or lightheadedness, especially after the first dose. This is due to the drop in blood pressure. Patients should be advised to change positions slowly to avoid falls. More serious side effects, though less common, include angioedema, a potentially life-threatening swelling of the face, lips, tongue, or throat. Angioedema is an allergic reaction that can obstruct the airway and requires immediate medical attention. Other serious side effects include hyperkalemia, a condition characterized by high potassium levels in the blood, and renal impairment, particularly in patients with pre-existing kidney problems. These side effects necessitate careful monitoring of electrolyte levels and kidney function. Section 4. Nursing considerations and monitoring. Nurses play a vital role in ensuring the safe and effective use of ACE inhibitors. Before administering the first dose, nurses should measure the patient's blood pressure and heart rate. This baseline assessment is crucial for monitoring the medication's therapeutic effects and identifying potential hypotension. Monitoring blood pressure regularly, especially after the initial dose, is essential to detect any significant drops. Patients should be educated on the signs and symptoms of hypotension, such as dizziness and lightheadedness, and advised to report them immediately. Monitoring serum potassium levels is equally important, as ACE inhibitors can cause hyperkalemia. Patients should be advised to avoid potassium supplements or salt substitutes containing potassium unless otherwise instructed by their healthcare provider. Renal function monitoring is also crucial, especially in patients with pre-existing kidney disease or those on other medications that affect the kidneys. Regular assessment of serum creatinine levels helps detect any signs of renal impairment. Section 5. Drug interactions to watch for. ACE inhibitors can interact with other medications, potentially leading to adverse effects. Nurses must be aware of these interactions to ensure patient safety and medication effectiveness. One important interaction is with potassium-sparing diuretics, such as spironolactone, also known as aldactone. These diuretics can also increase potassium levels, and combining them with ACE inhibitors significantly elevates the risk of hyperkalemia. Careful monitoring of potassium levels is crucial when these medications are used concurrently. Another important interaction is with lithium, a medication used to treat bipolar disorder. ACE inhibitors can increase lithium levels in the blood, increasing the risk of lithium toxicity. Close monitoring of lithium levels is essential when these medications are combined. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs such as ibuprofen, branded as Advil, and naproxen, branded as Aleve, can reduce the effectiveness of ACE inhibitors. NSAIDs can counteract the blood pressure-lowering effects of ACE inhibitors, potentially leading to uncontrolled hypertension. Section 6. Key points for NCLEX success. For aspiring nurses preparing for the NCLEX, understanding ACE inhibitors is paramount. Remember that first-dose hypotension is a common side effect, emphasizing the need for baseline blood pressure measurement and cautious administration of the initial dose. The characteristic dry cough, while often benign, can be bothersome and lead to treatment discontinuation. Educating patients about this side effect and exploring alternative medications if the cough becomes intolerable is essential. Angioedema, a potentially life-threatening allergic reaction, requires immediate recognition and intervention. Nurses must be familiar with the signs and symptoms of angioedema and be prepared to respond promptly if it occurs. Hyperkalemia is another serious side effect of ACE inhibitors, emphasizing the importance of monitoring potassium levels, especially in patients with renal impairment or those taking potassium-sparing diuretics. Finally, remember that ACE inhibitors can impact renal function, particularly in patients with pre-existing kidney disease. Regular monitoring of serum creatinine levels helps detect any signs of renal impairment. By understanding these key points, aspiring nurses can confidently answer NCLEX questions related to ACE inhibitors and provide safe and effective care to their future patients.